Thank you for joining me this morning. I'm honored to be among so many incredible advocates working tirelessly to make sure that every woman has access to the health care that they need. I'm here today because this Supreme Court fight will define our country's future. It will decide the rights that we and our children will have for generations to come. I'm someone who depended on Planned Parenthood for basic checkups in college. I'm also a mother who for years struggled to get pregnant and will be forever grateful for the maternity care that helped me to have my two wonderful daughters, and also for the privacy rights that allowed me to use the IVF in that process. So I know just how valuable, how life-changing affordable health care can be. But I'm also a woman of color, and one with a whole host of pre-existing conditions, which means that I'm exactly the kind of person whose health period, would be on the line if Brett Kavanaugh is confirmed to the Supreme Court. I've read Judge Kavanaugh's rulings, and it's no exaggeration to say that his confirmation would have grave consequences for women of color who suffer from pre-existing conditions at a much higher rate than the general population. Through past rulings, Judge Kavanaugh has already shown that he's just fine with the idea of gutting the Affordable Care Act, even if that leads to countless families going bankrupt if a loved one has the nerve to get sick. And in a matter of months, the Supreme Court may hear a case that could strip away protections for Americans with pre-existing conditions, with Justice Kavanaugh likely serving as the deciding vote. Imagine how many women would have to choose between paying for the care that they need or paying their rent if Kavanaugh gets onto court and slashes these protections. We cannot let that become a reality. We cannot go back to the bad old days when women were charged more for care just because they were women, when being a mom counted as a pre-existing condition, and when women of color were much likelier to get priced out of insurance plans because they suffered from diseases like diabetes and asthma at higher rates than the general population. My heart breaks when I think about how Kavanaugh's confirmation would hurt expectant and new moms too, who would have a harder time getting access to the maternity care that they need. We are the only developed nation in the world whose rates of women dying from pregnancy-related causes is still rising, with Black women in particular more than 3 times more likely to die during childbirth. They deserve better than a judge who's already using his power to make it harder for women to access care. So yes, I'm a mother, I'm an American with disabilities, and I'm a woman of color. But I'm also a fighter, and I promise you that I'm going to pour my heart into stopping the confirmation of a man who'd rather cater to President Trump's whims than look out for the health of millions of women and women of color. Thank you all again for being here today. Now, I'd like to introduce Fatima Gross-Graves, the president and CEO of the National Women's Law Center, and a woman who's truly used her platform for good.